Urbanization is a global phenomenon, but over the last few decades, this trend has been predominant in developing nations. Of the total urban population in the world, 10% are found in one nation, India. Over the next decade, India's urban population is likely to touch 550 million. An analysis of population growth trends between 1991 and 2001 shows that while the national annual growth was 2%, urban India grew at 3%, megacities at 4%, and slum populations rose by 5%. At present, the number of urban poor in India is almost 100 million. The most visible among them are the people living in slums. But there are also many others living without the luxury of a roof over their heads or other basic necessities of life. The living and working conditions of the poor have a direct impact on their health. Lack of toilet facilities and sewage systems compound the risk. Around half of all urban poor children miss total immunization before completing 1 year and are underweight. Out of every 1,000 children, almost 73 die before they reach 5 years of age.
If you look at the entire development story of this country, you will see that the rural poor have been benefiting from several sources, whether it is rural development programs or health programs or education programs. But contrast this with what has happened to the urban poor and you will realize they have not been provided those facilities. The National Urban Health Mission is to provide holistic health care which is affordable, in fact in many cases free, to the urban poor.
Since 2001, USAID has partnered with the Government of India in the area of urban health. In response to the proposed National Urban Health Mission, NUHM, USAID India started a technical assistance program known as Health of the Urban Poor, HUP, in 2009.
I think more recently, 2009, is basically where the HUP project developed. And I think this one was notable perhaps because of the extent to which it synced, it linked in with the government's own programs and sort of the engagement with, at a national level, but also at a state level. It was aimed to make a difference. And again, I think it was very explicit, it was very focused, it was very targeted, and it really was about health in urban areas.
The implementation of the HUP program was entrusted to the Population Foundation of India, PFI. The program was implemented in partnership with Plan India, IIHMR and BCT. In addition, SEDPA, MIA and IIPS were associated as technical partners.
PFI is an organization that works on health issues with a focus on women's health. But in this program, we went much beyond women's health.
Apart from maternal and child health and nutrition, the program also laid emphasis on issues related to water, sanitation and health, or WASH, by sensitizing communities on use of toilets, use of safe water and hand washing at critical points. The HUP program was initiated in 8 states and 5 cities on a pilot basis. Under the program, the implementation of 5 essential NUHM components was demonstrated. Mahila Arogya Samitis, MAS, Urban Health and Nutrition Day, UHND, City and Ward Coordination Committees, Health Management Information System, HMIS, City Health Plan, CHP. To involve the urban poor in healthcare programs, women volunteers from the community itself are mobilized to form Mahila Arogya Samitis or MAS. Their roles include enhancing awareness of health services, generating demand for them, and monitoring their provision. For this, they are given appropriate training.
ट्रेनिंग में हमको गरोदर महिलांची काळजी, लहान मुलांची काळजी, त्यांची लसीकरण, गरोदरपणात आहार कसा घ्यायचा, 6व्या महिन्यामध्ये 6 महिन्यापर्यंत बाळाला दूध पाजायचं, 6 महिन्यानंतर बाळाला वरचं अन्न द्यायचं.
निरोध कसा वापरायचा इथपासून सगळं त्यांनी डीपमध्ये दिलेलं आहे. एवढं अनमोल ट्रेनिंग त्यांनी दिले, याचा मला खूप अभिमान वाटतो. म्हणजे
In their monthly meetings, MAS members use health resource maps to track the health needs and provision of services to the community. They also conduct home visits to counsel families on health and sanitation issues. To address gaps in service delivery and access, Urban Health and Nutrition Days, or UHNDs, are organized by rotation in each locality every month. These are usually conducted in government childcare centers or Anganwadis. Services include immunization, antenatal care, and counseling on family planning, nutrition, and wash issues. MAS members play an important role in UHNDs by mobilizing the community to attend them.
because of that, many of the patients are getting benefited due to the camp, like the ANC mothers who were not aware of ANC registration, early registration and all. We are able to screen high risk pregnancies.
Then later on we shifted over to the non-communicable UHNDs. So we started with doing the weight, blood pressure, ECG and HB in the slums. And these non-communicable UHNDs have been very eventful actually.
Often issues emerging from community meetings need intervention at the level of local administration. City and ward coordination committees are important platforms where officials from various concerned departments are able to address issues raised by mass groups.
एक बड़े शहर जो पूना हम देखते हैं कि 40 लाख के आसपास आबादी है और 15 से ज़्यादा क्षेत्रीय कार्यालय हमें केटर करने हैं, तो इस हिसाब से डिसेंट्रलाइज करके क्षेत्रीय स्तर पे 15 जो वार्ड ऑफिस है यहाँ इस तरीके की हम समिति स्थापन कर पाए और कोऑर्डिनेशन कमेटी को डिसेंट्रलाइज करके और अच्छी तरीके से हम जो महिला आरोग्य समिति वगैरह निर्माण करना, इसमें काफ़ी अच्छा अनुभव रहा और इस वजह से हम काफ़ी हद तक अच्छा काम कर पाए.
The reach of health services among the urban poor is tracked through a Health Management Information System, HMIS. Under the system, MAS members and link workers identify the women and children requiring healthcare services. Based on this data, they generate a due list that is used to track the uptake of services. The HMIS data also helps city and ward coordination committees to plan and monitor health services in the community. To facilitate better planning for these four components, a comprehensive city health plan is formulated. This includes details about the city's needs, the key stakeholders, and the services required by the community. PFI's contribution by design has been to do vulnerability mapping and develop guidelines so that health services reach the most marginalized populations. Every challenge provides a golden opportunity to surge ahead. In its 5-year journey, the HUP program has left a lasting impression on local administrations across various states. The HUP team has developed valuable technical guidelines and training manuals. This material will strengthen planning and implementation of programs for future generations of the urban poor.
तकनीकी संस्थाओं की बहुत सख्त ज़रूरत है अर्बन एरिया में हेल्थ सिस्टम्स को इम्प्रूव करने. काफ़ी सारे गाइडलाइंस बनाए गए, ट्रेनिंग दिलाने में मदद की गई.
Health of the Urban Poor program was useful for the state because it helped us in the planning process. It helped the cities to make their planning process much more focused because resources are always at a premium and they have to be optimally used. So we needed to know exactly which part of our population and which part of our cities needed to be reached out first.
जो उनके लिंक वर्कर हैं और महिला आरोग्य समिति है, उनका जो प्लान ऑफ एक्शन है बहुत बढ़िया तरीके से उन्होंने प्लान किया है. लोगों को योजनाओं के बारे में काफ़ी कुछ पता चला है, लोग खुद का हक समझ रहे हैं, फैसिलिटीज़ का फ़ायदा उठा रहे, ले रहे, वहाँ तक उन लोगों तक पहुँच रहे हैं।
With this kind of initiatives and active work undertaken by MAS, we have our urban community development department along with the health department, which, looking at the success here, we will be incorporating all these MAS and the link workers into our mainframe system.
We got enormous input from government officials, not just in Nirman Bhavan in the health ministry, but at the state level, district level. We worked very closely with the NHSRC, which is the government's technical agency that has been supporting the NRHM.
The takeaway has been is that it has managed to create an environment of planning and strategy in the states, which has helped the states formulate and implement an urban health program, which essentially was new to the state. Now these learnings we will gather and use it in the rest of the country.
I think what really matters ultimately, of course, is life itself. This is about health. That's the most important thing. I guess there's that Hindi expression, "Jaan hai to jahan hai," and I think that kind of captures it. I mean, more than anything, life is what matters.